All right, let's go ahead and talk about the top 6 things you can do to increase your Social Security benefits. My name is Ed Weir. I was a former manager of the Social Security Administration. If you're new to this channel, let's go ahead and get started. So this is 6 plus ways. I usually almost give everybody a bonus, so I'll throw a bonus in there. So this is 6 ways to increase your Social Security check. Some of them you have to take action on. Some of them are actually automatic. I get comments and questions all the time. Will my benefits ever increase? So this is to address that question. Hopefully, this will be a complete waste of 10 or 15 minutes of your life because you have made all the right decisions and Social Security Administration treated you right and all your benefits are 100% perfect. So hopefully that is the case. But unfortunately, as you can read in all my comments, and the reason in my Social Security retirement, I am helping people with all my experience is because there's millions of people out there that are not receiving all the benefits they're entitled to and earned. But hopefully you are. And after 10 or 15 minutes, you're going to yell at me and say, you just wasted 10 or 15 minutes of my time. I could have been watching cat videos. Hopefully that is the case. But if you do need to correct something, don't worry about it. I'm here to help. After we do the 10 or 15 minutes and talk about the 6 plus ways to increase your benefits, then I do this pretty much every time. I'm going to open the floor to any type of questions. So make sure you type your questions in chat there, and I'll get to as many questions as possible today on all things retirement, survivor benefits, spouse benefits, Medicare, Medicaid, all the rest of it. Okay. All right. So, and if you're watching this later, and if you need to correct something, then again, just join my live and jump in chat and ask me questions about your particular case, and we'll walk you through the whole thing and make sure everything is correct going forward. All right. So the number one thing people ask about all the time is COLA. Okay. Even if I start getting retirement benefits, survivor benefits, disability, spouse benefits, whatever the case may be, do I still get COLA? And the answer is yes. COLA is added to every single benefit out there. And COLA, since the early 1970s, has been kind of automatic. In my personal opinion, over the last couple of decades, it should have actually, the way they calculate it is, I don't agree with. It should have been 2% more pretty much every year. But, that's just my personal opinion and millions of others out there. So if they would have added that 2%, then your benefit amount would have, been quite a bit more. But anyway, but COLA never stops, and you don't have to do anything on that. Basically, and you see a lot of videos out there that says, oh, you're getting more money COLA. Nobody knows until October. The final numbers, the way they calculate it, it's based on 3 months, the prior year, 3 months, the third quarter of the next year. So they don't know those final numbers until the very end of September. And then in October, Social Security and everybody makes their announcement of how much the COLA is going to be. So nobody knows until October how much the benefit is going to be. But again, that's one of those that you don't have to do anything about. You just wait for your benefits to increase and it'll start so in January. Number two is your high 35 years. People ask me all the time, says, okay, I am collecting Social Security benefits. Do I have to still pay FICA? Yes. What do they say? Death and taxes. So this is essentially kind of a tax. So you still have to pay FICA even after receiving Social Security, even if you've maxed out, because Social Security determines your benefit amount by your high 35 years of earnings. So if you are 80 years old and you worked last year, and last year was one of your high 35 years of earnings, and a lot of people say, well, no, the $20,000 I made when I was in 21 years old, that'll kick that out. Well, not necessarily so, because they index that. So that $20,000 you made when you're 21, that might be worth $80,000 now because they index it based on a kind of a wage index, inflation. So that might be more. So You don't have to do anything. It doesn't have to be consecutive years or anything like that. It's not your final year. It's not your last 5 years. It's the high 35 years of earnings. And that is automatically calculated. So if you worked last year, then if that's one of your high 35 years, then what happens is Social Security looks at that once they're notified. It takes a little bit longer. It takes longer than COLA because you have to file your taxes, notify the IRS notifies Social Security, and then Social Security looks at, oh, high 35 years, they kick out the low one, add the new one in there, and do the recalculation. That usually takes, again, once you file your taxes. So that calculation doesn't happen until, March, April, May, June. But if there's an increase, then they will go back and pay it effective January. So if there's actually an increase of, $10, $15 a month, then you'll get 3 or 4 months, a little bump there that one time, and then it'll be correct going forward. So FICA never stops. And to dovetail perfectly with that is another way to increase your benefits is make sure you're getting the right benefits to begin with and check your earnings record. I can't tell you how many times people are getting the incorrect benefits all their life because they never check the earnings record. And that's why Social Security, in the old days, they used to send out the statement every year. So you could check and say, okay, yep, oh, they had my earnings for last year. Okay, everything's cool. Congress said that's too expensive to do that. Now you can go on the internet. So go into SSA.gov, My Social Security, set up a My Social Security account, and get everything set up to make sure you check on a yearly basis. When tax season is over, don't put your taxes away until you go into SSA.gov and check to make sure your earnings from last year are correct. And if they're not, then come back here and we'll walk you through the whole process of how to correct it. If you find that you had, earnings, you look at it and it says 0 for 1982, and you're like, wait a second, I worked in 1982. Then you have to get those corrected, because if there is a gap there, that's going to affect your monthly benefit for the rest of your life. And please, please, please tell this to all the young people in your life, younger people in your life, 20s, 30s, 40s, 50s. Tell them, oh, did you do your taxes? Oh, yeah, I hate taxes. Yeah. Did you do that final step by going into Social Security and making sure they have those reflected in there correctly? Please, because after 10, 20, 30 years, if they don't catch it till that time, they might not have the proof to correct that, and then they're going to lose those earnings for the rest of their life. So please make sure everybody does that correctly. And I want to stop here for a second and say, okay, these are the only ways your benefits are going to increase. There's a lot of clickbait out there that are talking about, the YouTube and TikTok and, these fake news articles, and they say you're going to get more money next month or next year, and $2,000 is coming and $200 is coming, and then you click on it and read it or listen to it, and it's just all just BS. If there's any new programs that are available above and beyond what we're talking about today, if Congress passes anything, actually passes, it's not some type of proposal. That's one of the gimmicks people use, is they, sorry, West Virginia, but let's use my hometown, Paris, Texas. Some congressman from Paris, Texas, that represents that area, has some proposal that we're going to give you free ice cream and unicorns for the rest of your life if you're on Social Security. And that's just a proposal for them to get votes. And that's it. They're just trying to get votes. But somebody picks it up and makes a YouTube thing. Oh, y'all are getting free ice cream, unicorns for, no, that's just some proposal someone's trying to use to get votes. So subscribe, and I will keep you up to date. And most importantly, I will tell you how to take advantage of said policy. You see the new policy or new program in the news or something like that, a reputable news source, and you're like, oh, okay, well, that's a new trend, but how do I take advantage of it? Well, you come back here and I will show you how to take advantage of it based on my decades of inside the bureaucratic beast experience. Okay, number 4, military time for all you veterans out there. And let me throw up the little chart here. I'm an old Marine Corps sergeant. So the veterans out there, there is a little extra benefit that they get. And what happens is when you file for your retirement benefits, the Social Security employee is supposed to ask you whether you served in the military, and they'll ask you what years, and they'll probably provide a DD. You ask you to provide a DD 214, and let's just make sure everything was added in there correctly. So basically, if you served during these times, 57 through 77 or 78 through 2001, Social Security adds a little bit of extra earnings on those quarters. And this is not an extra $300 a month or something like that. Again, a lot of clickbait out there says, yeah, you're going to get $300 extra, whatever. No, it's added into those earnings. So if you had $10,000 of earnings that quarter, then Social Security is going to add 10,300. They're going to add $300. So I mean, it's not a whole heck of a lot, but hey, a buck is a buck is a buck, right? So, and it's your money, so go ahead and get it. Okay, so military time. Just the easiest way to just call Social Security and say, "Did you add my military time?" And if not, just grab your DD 214, go to nara.gov, NARA.gov, and you can request DD 214 if you don't have it. Here is the big one. This is, if you've been watching my videos for any length of time, I just started this old YouTube crazy thing within the last year or so. Yeah, there's a lot of people that are just not getting the right programs. So up until the 1, 2, 3, 4, that's some money there. But this is where people lose tons of money. All right, so this one takes a little time, and this one you need to probably come back and ask questions and watch some of my other videos. So are you receiving the right type of benefit? If you're receiving retirement benefits, should you actually receive WIB, as we call it inside the inside the bureaucratic beast, widow's insurance? So if you're currently receiving retirement benefits and you were married to someone for 10 years or longer, and at that time, when you filed for your retirement benefits, the Social Security employee, were you married to anybody for 10 years or longer? And you'll say, yeah, I was married to this person, for 10 years longer. And they look at it and that person is still alive. They said, okay, you're not entitled to more benefits. But since that time, that person has passed away. So now you're entitled to up to 100% of those benefits. And there's so many people out there that are just walking around and, losing hundreds of dollars every month because, oh yeah, that person passed away. It's no longer 50%, it's 100% of that benefit amount. So please call Social Security and say, hey, can I collect on that person's record? And another thing, if you're receiving survivor benefits, the opposite side, if you're receiving survivor benefits from a deceased spouse and you haven't touched your own retirement benefits increase to 67, full retirement age, 66 and 8 months or whatever, and all the way to 70 when you get those delayed retirement credits. So if you've been on survivor benefits for a while, call Social Security, definitely before 70, because they don't increase after 70. Call Social Security and say, hey, by the way, how much is my benefit now? And they say, oh, wait a second, there's more money on your record. Let's switch. So definitely. And spouse benefits, so many people, they don't know they're entitled to spouse benefits. They were married 1, 2, 3, 4 times, and they say, well, I can't get it on the first spouse because I got remarried after that. No. You can get it on any of them. I've taken hundreds of thousands of retirement claims, and I ask people, I say, how many times are you married? I was married 3 times. All right. 10 years longer? Yep, all 10 years or longer. All right, let's go through them. Number 1, how much money? Oh, no money there. Number 2, it's extra money. Let's see if there's any more money on 3. On spouse 3. Oh, not enough on 3. 2 looks like 2's the winner. All right, let's go ahead and take a spouse claim for that particular person. And again, you're getting spouse benefits on that particular person, but then your third spouse passes away early, and you can actually now switch on to the third spouse. Or maybe the third spouse didn't have that much earnings when you checked 5, 10 years ago, but since then they've made a lot more money. So please make sure you're getting the right amount of benefits. And then the IEDS, it's called Independently Entitled Divorced Spouse. I've got a video on it. I've got over 300 videos I've made over the last year, and I'm making more every day, trying to build a resource out there. The Independently Entitled Divorced Spouse, so again, hundreds of millions of dollars people losing with all these. If you are receiving benefits on your own record and you're saying, well, I can't file for spouse benefits because he or she hasn't filed for benefits yet, that is incorrect. That is 100% incorrect. Please pass this on to everybody. As long as that person is 62, even if they're waiting till their full retirement age or waiting till 70 or whatever the case may be, that doesn't matter to you. If you're married to that person for 10 years and they're at least 62 years old, you can get spouse benefits. It's called an independently entitled divorce spouse. All right. Another one is disability benefits before your full retirement age. If you are 62 years old, you go ahead and file for retirement, and then you become disabled, or you at 62, you're retirement and you're actually disabled, but you want to go ahead and start retirement. You don't know if you can get disability. You can apply for retirement and disability at the same time, 62, 63, 64, 65. If you're receiving retirement at 62 and then 2 years later you become disabled, then file for disability benefits. Okay. Once you hit your full retirement age, there is no more disability. Everybody is switched from disability benefits to retirement benefits once they hit their full retirement age. But it's good to get disability if you're eligible, because another thing is you get Medicare early. You get Medicare after being on disability for 2 years. All right. And then there's SSI, which is a supplemental security income program. That is if you are aged, 65 years old, or if you're receiving disability, a low disability, there is possibly some supplemental benefits that are available to you. And on all of these, check, watch my videos. If you're watching this on a recording later on, if you're not watching live, come back and make sure you ask questions, and let's make sure you're getting all the benefits you're entitled to. And please share this. I guarantee that someone, if all this doesn't help me at all, Ed's wasting my time. Awesome. Again, that's beautiful. That's what we want. That means Social Security did their job, and you made all the right decisions. But I guarantee you, someone in your network, your family, friends, Facebook, I guarantee they're not getting the benefits they need and are entitled to. And it's one of those 7 degrees of Kevin Bacon type thing. You send this out to them and they send it out to someone else, and now they're getting what they're entitled to, and they think that person thanks you, and you become a hero. So they're eternally grateful to you. So it's a beautiful thing. All right, number 6 is, I just did a video on this a few days ago. Suspend. You can suspend your benefits when you're taking early retirement. Every month you retire early, your benefits are reduced. Pretty much with all Social Security, survivor benefits, spouse benefits, retirement on your own record, your benefits are reduced when you take those benefits early. Okay. But if you decide to go back to work or something like that, you can. Beautiful. Go back to work. Just call up Social Security if you're going to make way over the annual earnings limit. Again, they hold back $1 for every $2 you go over. If you go over that amount, then they hold that money. So you might want to suspend your benefits. And then what happens when you suspend your benefits, when you're 63, 64, they recalculate everything once you hit your full retirement age. So if you take a 30-month reduction because you took it 30 months early, but then you stop it after 10 months, when you hit your full retirement age, they're going to throw those 20 months back in there. They'll recalculate it to make sure you're just reduced for 10 months for the rest of your life. And you can also do this. I just did a video on this. This is something that pretty much nobody knows. And you'll have to watch that video and get the reference, because when you go into Social Security, they're not going to know it either. It's you after you hit your full retirement age. If you're able to, you can actually suspend your benefits after full retirement age and get those delayed retirement credits, 8% per year. And again, watch my video I did on that a few days ago. When you go into Social Security and ask them about that, they're gonna, look like a deer in the headlights, because almost nobody does it because they don't know about it. All right. So that's number 6. I'm going to throw a bonus in here, and then we'll open up the floor for any of your questions. Comment down below. Say, Ed, you wasted 19 minutes of my time. I made all the right decisions, and this is what we want. We want Social Security to treat you right. I worked there for a few decades. I ran the 3rd busiest office in the country. Please let us know. I made all the right decisions, and Social Security treated me right. Customer service was wanting, but at least I got the correct benefit amount. So comment about down below and tell us that you made all the right decisions. Um, and I did a video um, about a month or so ago. It's called "Living on Social Security Alone." Let me pop it up, and I'll show you what the video looks like. And it was a 4-part series, and let me get this little thing. It was a 4-part series on living on Social Security alone. So this is part 1, and there's 48 different programs in there that will help you or someone you know, financial assistance program, extra benefits from federal, state, local, private companies. So make sure you watch all 4 of those. And I have to apologize. I'm not great at YouTube and all that stuff. The intro to number 1 is like way, way, way too long and boring and slow. So that's why I'm talking a little bit fast, because people say you're too slow. There's just so much information. Social Security has exceptions, the exceptions, the exceptions. So this is not something you can do, super, super quick. I mean, you can do it quick, but then you won't get all the information you need. So that's the important thing. So make sure you watch that and share that. All right, here's the bonus. Don't waste money on Medicare if you don't need it. If you have insurance from work, yours or your spouse's current work, and they have your employer plan 20 more employees, and you're happy with it, all that kind of stuff, you do not have to do anything at 65 years old. You don't have to sign up for Part A. You don't have to sign up for Part B or any of that. Don't waste your money if you don't need. And one of the things I'm seeing too much is people getting Part D penalties for the rest of their life. Because at 65, if you pick a Medicare Advantage plan, those usually have Part D bundled in there. But people that pick the Medicare Supplement plan, which is the ones I recommend, if you can afford the monthly premium, they say, well, yeah, I'll just go ahead and get the Medicare Supplement. I don't need the Part D because I don't take drugs. You're going to get penalized for the rest of your life. I'm sorry, whoever signed you up didn't tell you that, but I watch my comments. I just got another comment yesterday. Some lady is going to get penalties for the rest of her life. So make sure, you have a Part D plan, or you will get penalized. So once all of this is correct, if everything is correct now, you're beautiful. Just comment down below that you made all the right decisions. The only thing you have to do in the future is, if everything is correct, just watch out for any type of updates, program changes, or anything like that. The Social Security, the government brings down. Subscribe to this channel, and I'll keep you up to date. And again, show you how to take advantage of those programs. And if you have Medicare Advantage, those plans are only good for 1 year, and they often change the underlying things, which you don't really notice until it's too late. So make sure you check those, review those on a yearly basis. Who cares? Who cares? It doesn't matter if it's the same company. It's got your doctors. The same company, your company that you use probably has 5 or 6 or different plans in your area, and you're on the old plan, but the new plan has better savings, and you don't know it until it's too late. So review that every year, particularly in October when the new plans come out for the following year. If you have a Medicare supplement, you don't have to review those every year, but you might want to check to see if your Plan G is increasing in price. You might think about going to a Plan N, save yourself some money. And if you're on a supplement, hopefully you have Part D, you're not pinning those penalties. That is one thing you definitely have to change, or review every year. So the Part D plans change every year, the tiers change and everything like that. So even if you don't take drugs, the Part D plan, there's plans out there for, $5, under $5. So that's not a big expense. Okay, that's it. And let's go ahead and open it up. And if you're just here for all of that and you don't have any questions, have an awesome night. But let's go ahead and answer all these questions, and let's see what we got here. All right. Alejandro, hello, doctor. My current wife has a disabled blind daughter. If my wife her mother passes away, being my maximum benefit is $3,500, her daughter will still receive the benefit. All right. So I assume if my wife who is passes away, yeah. So the daughter would get benefits on um, the parent's record. So hopefully the mother also worked and paid into Social Security, and yeah, so wouldn't they could potentially be qualified on your record depending on the relationship and all that kind of stuff. But yeah, if a parent passes away, the child can get benefits. But if the child is disabled, now the child can get benefits from a parent. Now it's up to 50%, and there's a family max involved. But there's 50, you can get 50% if one of the parents is receiving either retirement benefits or disability benefits, or they pass away. If they pass away, it's actually 75%, up to 75% of the person's full benefit amount that they can receive. So yeah, those are definitely available out there. All right, let me throw my phone number and email. So if you need help with Medicare or barely insurance, all that, I put a team of those throughout the country because I'm tired of people not getting the correct information. So I decided to put together my own team. So Alejandro, second follow-up question here. Hello, can you explain the child and care benefits for the parent who's taking care of a disabled child? Yes, yes. I thank you, Alejandro. People always, always on point here. So yes, that is another benefit out there. I was trying to do my 6 things quick. People always say you got to be quicker. Okay, I can't be quick. Anyway, but yeah, there's also a benefit called auxiliary child and care or surviving child and care. So if you have someone in a parent that is receiving benefits, the other spouse can actually receive benefits. Doesn't matter what age they are, if they're taking care of the person that receiving benefits child, and that child is receiving benefits themselves. Um, and it's called a child and care benefits. They still have to stay under the annual earnings limit in terms of $22,320 this year, but the child has to be 16 or under or disabled. So there is money there. There's a family max involved that there's only a certain amount that can be paid out on the record. But if you only have one child, then it shouldn't be an issue. So I would call Social Security and kick around the options. Again, if your wife is not working, not making over, the annual earnings limit, then absolutely call and say, hey, we want to, kick around our options for child and care benefits. They'll run all the numbers and tell you how much she can get. Please, please, please do that. Joseph, what's up, Joseph? Oh, please, everybody press like. When you press like, this video goes out to more people and you are helping someone you don't know. So you're paying it forward and you're helping people find the money they need and are entitled to. Joseph, question. My neighbor is a widow who receives an insurance payment from the death of her former husband. She has no health insurance and is 63. Yeah, so I would definitely have her check out the Affordable Care Act, Marketplace, Obamacare. It's all the same thing. So she might be able to get subsidies. Those are kind of pre-tax credits, advanced tax credits, but they're essentially subsidies to help pay for the premium and cost sharing as well. So you can give us a call, and I've got people that do that throughout the country as well, and they can help her out. So there's a little follow up there. Let's see. Joseph also says she has also said the lawyer told her she was not eligible for Social Security or Medicare. Yeah, she's definitely not eligible for Medicare because she has to be 65 years old or on disability for 2 years. So she's not eligible for Social Security. So she never paid into Social Security on her own record, or her deceased husband never paid. Yeah, I don't see how a lawyer would know that. So yeah, I would call Social Security directly and confirm, because the lawyer doesn't have access to her record, so they wouldn't know. So lawyers. Are they outsourcing medical review for disability from Fort Worth to Arkansas? I think scam. No. So yeah, yeah, the DDSs, the disability determination services throughout the country, they're, in each state, they're a state agency, and those are the ones that make the medical determinations. And yeah, that is a very common thing. I ran the third busiest office in the country, and our DDS and our administrative law judge, they were always inundated and they had too much. So they would outsource. I think actually we've sent several thousand cases of ours to the one in Dallas. I think it was, yeah, Dallas. Yeah, we actually sent it to Dallas. Um, but now I guess it's now Fort Worth, Dallas, DFW area is packed. So they're sending it next door to Arkansas. So nope, that's it's obviously has to be the DDS, but that does happen. So it's not necessarily a scam. It does happen, and which is great. I think Social Security should do that more. I did a video a few days ago on customer service, and Social Security needs to do that more, kind of workload mobility. Some offices have time, have resources to do stuff, and other offices don't. So to improve customer service, I think that should be done more. Hey, M Steele, what's up? I had a coworker come by my desk, and he said he's retiring in December this year. I told him, you need to check out this channel. Great information. He will be 65. There we go. I like it. As a regular there, M Steele. Thank you. Yeah, tell him to check us out. Demi, and please, everybody press like and subscribe and all that kind of stuff. If I found out accidentally while on a call with SSA, I will start getting SSI on the first, been drawing disability since 2018. How long will it be till I receive an award letter? You find out accidentally while a call, I will start. Oh, okay. Well, all right. Yeah. Accident. It's information that's pertinent to you, so they should give it to you. Yeah, if they said you're getting SSI, that you're approved, that means you're approved for disability. So congratulations there. I know that was probably a nightmare process. Yeah, it really depends. If you're approved for SSI, they'll have to do what's called a perk. Basically, when you took the claim, when you filed originally for disability, 3 months, 6 months ago, 15 years ago, whatever it was, they took all the disability information, the medical information, all that kind of stuff, but they also took the financial stuff for your SSI claim. But it's been months since that time. So what they'll have to do is they'll call you up and they'll do this perk, that's called, where basically they'll update the information to make sure, you didn't win the $1 billion lottery within the last month or two and stuff like that. Make sure everything is still the same. Make sure you're still entitled to SSI. So yeah, so expect a call from your local Social Security office on that. Jeff, extra money would be nice if I ever got it. Today, I tried to get some of my SSI money from bank. Is that a bank thing? It wasn't there. Bank won't call back. Can't get through to ATM company. What's going on? Yeah, you're probably using Direct Express, which Direct Express, you think Social Security customer service is terrible. Direct Express is it's horrendous. Yeah. If you can avoid Direct Express, please do. A lot of people can't because they can't set up an account, bank account for some reason. But there are banks out there that specifically allow you to set up an account if it's for federal benefits. So I would call around and say, hey, I get a Social Security check and I get that automatically deposited. Can I set up a bank account here? And so yeah, avoid Direct Express as much as possible. Yeah, but the only thing you can do is, call them up and stay on the phone. If you go down to the local Social Security office, they really can't provide much help either, because I've done it too many times where I sat there on the phone too, trying to get into someone to Direct Express, and yeah, they just don't pick up. So, all right, Nancy, yes, I made the right decision and Social Security treated me right. I like it. Good to hear that. All right, so I wasted 18 minutes of your life. Could have been watching cat videos or something really, really good, but sorry about that. All right, Kate, I'm turning 62 this month. I received my benefits in July. Awesome. So hopefully you did check your earnings record and all that kind of good stuff and make sure you're getting your correct spouse benefits. And awesome. Good deal. Good deal. Margaret, how much of a decrease if I collect widow's benefits at 60 and then can I switch to my retirement? Yeah, it really depends on the benefit amount. So that is a good one. So that's yes. Um, that is part of that whole widow's own benefits strategy. Even if your widow's benefits is less, so you started collecting it at 60. So um, even if the widow's benefits is less when you hit 62, 63, 67, or whatever the case may be, it might be a good idea, again, depending on your particular situation, to take the smaller amount because your benefit amount is going to continue to increase until you're 70 years old. So you're like saying, okay, I'm losing, $50 a month every month by staying on the widow's benefit. But once I switch over, in a year, it's going to be $100 more on this one. So it really depends, obviously, in your health and your, genes, life expectancy, and all that kind of good stuff. So, Tony, like, does SSI? Okay, we got AAA. Okay. Thank you. You're awesome. You're awesome. Thank you for what you're doing and all the excellent information. I forwarded the link to your channel to many people I think will be offended. All right, Kristen. Perfect. Appreciate it. Thank you. Thank you. Thank you. Yeah. All I was going to do is watch read the comments and all the people who you've helped. I can do these videos and, talk until I'm blue in my face, but if it doesn't get to the people that it needs to get to, then, it's useless. And the only way it gets to people that it needs to is by y'all sharing and putting in your Facebook and liking and subscribing and all that kind of stuff. So please, please, please. In fact, hey, what's up? If one is closing in on 65 and receives Medicaid and will be automatically signed up for Medicare, is it smart to avoid the premiums? How would you avoid the paying the premiums? Good. Yes. That's another one of the billion ones I should have talked about in the 6 things is called the Medicare Savings Program. If you're on Medicaid, call it Medicaid and say, hey, by the way, I'm turning 65. If you're entitled to Medicare, they're going to send you the Medicare card automatically. But I'm going to be charged 174 and change. Y'all need to hook me up. So this Medicare Savings Program, Medicaid, depending on the level of Medicaid you receive, whether it's QMB or SlimB or QI, there's different versions of different parts of the country. If you get one of the higher levels, then the Medicaid office will pay for your Part B because it's cheaper for them to do that. It's cheaper for them rather than paying like, $5,000 a month for your health care. They just pay the $174 and then the federal government pays for it. Yeah, it's just a bureaucratic, one hand, whatever. So yeah, call up Medicaid and say, hey, I'm, approaching 65 and I'm going to get a Medicare card. So please pay for it. And this is another thing that Social Security is really, really wanting at is, you get ping ponged when that happens. Is you go down to Medicaid office and you tell them that you're getting Medicare and you want them to pay for premiums, and they say, oh, you got to go to Social Security for that first, and then you go to Social Security, and then Social Security, oh yeah, you got to go to Medicaid. It's a whole nightmare. The 2 systems, because there's 50 different computer systems for Medicaid, each state does it differently. So quite often they don't talk to each other, and unfortunately you get stuck in the middle. So I apologize for that. Julia, TIZ, I haven't had any problems with Chime for my Social Security deposits. Are they beginning to prove unreliable? No, if everything is consistent, the customer service is what's the issue. If you have an issue, then it's very difficult to get it addressed because they don't pick up the phone and stuff like that. But if you don't have that type of issue, then it's just a regular direct deposit, then you should be good. All right, I got a bunch of TikTok questions here, and I apologize, TikTok, I can't show you my screens. I need 10,000 subscribers to TikTok to do you all right. So please, everybody subscribe and like and all that kind of good stuff. Let me see. My earlier question. Okay, what is the best way to start the process for disability? I'm in Oklahoma. Okay, yeah, it's a national program, so it doesn't matter what state you're in. Um, so I used to go to Oklahoma on every weekend. I lived in a dry county right across the border in Paris, Texas. So we used to have to go to Oklahoma to get alcohol. So, but that's neither here nor there. Yes, what is the best way to start the process? Is the best way to start the process is do it immediately. I've got 4 videos on my YouTube channel on filing for disability with a bunch of tips, tricks, and secrets. And so go in there and file, watch those videos, and do it as soon as possible, because you're going to be waiting for months anyway. So it's best to get the process started. All right. If you file at 62 as a divorced person who got remarried after the age of 60, can you file at 62? Okay, wait a second. If you file at 62 as a divorced person who got married at the age of 60, so you're currently married, so you can only collect benefits on the current spouse. Um, for half of the divorced spouse benefits without having to file for your own at 62. No, you have to file. When you file for living spouse benefits, you have to file for benefits on your own record first. If you're filing for survivor, then you can just file for survivor benefits and not touch yours. And that's the strategy I talk about letting yours increase. But if you're filing on your current spouse or a divorced spouse that's still alive and kicking, you have to file on your own record first. There was an old way that you could get around that, but they stopped that in 2015. Let me see. Will you get penalized for not signing up for Part B insurance once you start collecting Social Security? Yes, you will get penalized. Um, if you don't have current insurance from your work or your spouse's current work, and that insurance group plan has 20 or more employees, then you won't get penalized. So again, and you have to be happy with it, and there's no crazy deductible. It doesn't cost you a arm and a leg and stuff like that. If that, then you might want to switch to Part B. But if you have insurance from current work, you or your spouses, and you're happy with it, you do not have to sign up for Medicare when you're 65, or if you've received it because of your disability. You can wait, and then when you're 70 years old or 75 or 80 or 100, and you stop receiving health insurance from current work, not COBRA, not a retirement plan, but it has to be current work. When you stop working, you stop receiving that health insurance, then you technically have 8 months. But I always advise a couple of months before insurance is gonna stop because you're stopping work. Then you need to sign up for Part B, and you need to find out what you're gonna do to cover all the gaps, because there's a lot of gaps in Part A and B. The big one is the 20% co-insurance. So if you have $100,000 bill from your doctor, you have to pony up $20,000. So that's why everybody gets either a Medicare Advantage plan or a Medicare Supplement plan. And if you want to start kicking those around, watch my videos. I just did one a couple of days ago on the difference between Medicare Supplement G and N. And then give us a call or email me and say, hey, I need to find a Medicare plan, and I can find someone that is licensed in your neck of the woods, and they'll reach out to you and help you out. And full disclosure, if you like what they tell you and you decide to enroll, those people, the Medicare person you talk about, the Medicare broker you talk about, they support our channel. So it's a win-win-win situation. All right. I think we should all take our benefits as soon as possible, as they will. Yeah, a lot of people have that kind of philosophy, but it really depends on, you know, everybody's situation is different. If they're working and, or it's going to put them in a higher tax bracket, or, they're waiting for, increased benefits, or I lost a green card. Can I get Social Security? Yeah, you're going to need, you'll probably have to get a new green card to show your legal residence in the United States. So, and I know for DHS, the INS, you can't walk in there like you can a Social Security office. You have to actually set up an appointment. So I would do that immediately, if not sooner. But if you're entitled to benefits, if you're at least 62 years old or whatever the case may be, don't wait until you get your green card. Um, because you're going to be losing those months of benefits. So if you want your benefits to start this month, call Social Security this month and set up an appointment, because the appointment won't be for next month, it's because their Social Security is so backlogged. It won't be for a month or 2 months anyway, your appointment. And even, go to the appointment, pick up the phone when they call and say, hey, I applied for my green card a month ago, 2 months ago, and I'm still waiting for it, but I just want to make sure that I still get my benefit. I'm not losing those months of benefits. So call Social Security, protect yourself so you get everything you're entitled to. Let's see, non-working spouse could get Social Security disability before 62's husband is getting his. So it depends how long ago that person stopped working. Because for disability, you have to have two insurance statuses. One is you had to pay into Social Security for 10 years, 40 quarters, and all that, and that makes you insured. But you also have to be currently insured, which basically means you had to work 5 out of the last 10 years before you became disabled. Because Social Security, they say, okay, well, if you worked in your 20s and paid the 10 years and then, you didn't work for 20 or 30 years, and then you go into Social Security and say, I want to file for disability because I can't work. And so wait a second, you haven't worked in 30 years. So yeah, so you had to also be currently insured. So 5 out of the last 10 years. So if that is the case, and the 5 out of the last 10 years, it doesn't have to be consecutive. It doesn't have to be, so call Social Security and they can tell you whether she is currently insured. Just enroll in Medicare A and B. Best to get just Medicare D or supplement insurance. Well, you on supplement. So if you're talking Medicare supplement, which is also called the Medigap, you will need Part D as well, because those don't have Part D rolled into them. If you get a Medicare Advantage plan, most of those have Part D, the drug plan, bundled in there. Some don't, but most of them do. So if you have a Medicare Advantage plan, you probably have Part D, but I would call whoever enrolled you and just double check. Or you can call us and we can check for you. But if you have a Medicare supplement plan, then you have to get a Part D plan separately. Okay. So, and if you don't, then you're going to be penalized for the rest of your life. If someone received their father's benefits because he's deceased and served his country, lost it. Yeah, I'm not sure what the question was. How does TRICARE reduce Medicare costs? Yeah, so basically, TRICARE, you have to have Part A and Part B, and it's just a bureaucratic insurance type thing, first payer, second payer, and all that kind of stuff. So yeah, it's just, again, it's the Department of Defense moving cost over to CMS, Center for Medicare and Medicaid Services. It's one agency. If you're receiving TRICARE, then you have experience in the military. You know how the government works. All right, let's get to some more YouTube questions here. Lisa, I just turned 64 and would love to start taking my benefits, but I want to live overseas and I have to meet a specific amount for the visa requirement. I have to make and the Part B premium keep screwing me up. Okay, yeah. So for some places in the world, in order to get a was it kind of a non-permanent visa type thing, you have to show them that you have X amount of income coming in. But yeah, it really depends on the country. I mean, is it gross or net, or so yeah. But I get this all the time. I did a video on living overseas. It was about a week ago. So check out that video. But I get a lot of people that they say, I'm not going to sign up for Part B because I'm moving overseas and I'm never coming back. And then, okay, if that's your plan and that's definitely what you're going to do, then okay. But life is what happens while you're making other plans. And I get twice as many calls and comments of people that have been living overseas for a couple, 3 years, and they get sick, or they, just doesn't appeal. They just don't like the environment, or whatever the case may be. And then they come back. And if they come back because they're sick and they need medical care, they don't have Part B, then that means they're going to have to pay that all themselves. And they say, well, I'll just go ahead and sign up for Part B when you get back. Well, you can't sign up for Part B until the general enrollment period, January, February, March. So if you sign up in January, they changed the law last year, which is good. If you sign up in January, you'll start your benefits in February. If you sign up February, you start your benefits in March. It used to be very convoluted before. But yeah, if you get sick in July when you're in the Philippines or Portugal or wherever, and you have to come back, yeah, you're just gonna have to stay sick or pay a lot of money until February 1st. So there's that. So yeah, definitely, those are things to consider. Carla, what's up, Carla? I'm 67 and switched from my workplace insurance package to Medicare when I turned 65. I lost vision and dental coverage. I have Plan G. Can I get dental vision insurance separately? Absolutely. I work with a company. It'll be in the description. So click on that, and it has dental and vision and all that kind of good stuff. So yeah, definitely click on that. It's like super, super easy. It's kind of like Amazon shopping. You pick, 2 or 3 of the, if you need the vision part. If not, no big deal. But if you like, the dental, they gives you like 2 or 3 different options in your area, and you pick the one you like, and you just put it in the shopping cart, and you're done. Super, super easy. So that'll be down in the description there. All right, MT Vessel. Husband retired CalPERS, no Social Security contributions. I have 40 years towards Social Security, plan to collect at 70. If I outlive my husband, can I receive most of his CalPERS pension? How would this affect my Social Security? Okay, yeah, CalPERS, yeah, that's between, yeah, I don't do that's a non-covered pension through the California, system. So you were, state or local county employee. So yeah, that is a pension based on someone else's work. So that won't affect your benefit. If you are receiving CalPERS, then it would, from your own work. But since you're receiving it from someone else's work, that won't affect it. So you are good. Lisa, again, more info. It's a retiree visa with a required minimum income. Yeah, I hate having the Part D premium, especially when I could rarely ever use it. Yeah, that's why a lot of people don't get the Part D, and the people that sign them up for the Medicare supplement plans, the Plan G or the Plan N, which again is the ones I recommend. But the people that sign them up don't go the extra mile and tell them, okay, yeah, I understand you're not taking any drugs, but here's the penalty you'll pay for the rest of your life if you don't get this $1 a month, Part D plan. So yeah, there are ones out there for like 50 cents or something this year. It's crazy. Yeah. Oh, sorry. Let's see here. Oh, what's the question? Okay, Julia. Okay, there's responding to someone else about the, okay, good. So y'all are having a conversation without me. All right. I feel like I'm back in high school. No problem. Helping each other out. I like it. This is a community here. I'm 61 on SSI. Can I sell my house and move into income-based senior apartment? Does it affect your SSI payments? Yes. Yeah. One house is exempt while you're living it, and your one car is exempt. So they can't hold that against you for SSI or Medicaid or anything like that. Yeah, but once you turn that into cash, then it's cash. So it just might affect you if you make money. But if you make money for the sale and you use it immediately, it's called spend down. If you immediately spend it down to buy another place, a smaller place, or you have debts or medical bills, or you do spend it to buy a car so you can get back to doctor's appointments. So call your, if you're thinking about doing that and you have some of those exceptions, call your SSI claim specialists at your local office and tell them and say, hey, I'm going to sell my house and I'll probably get, $20,000, but, I got $20,000 of debt or credit card bills or something like that. And I'm going to immediately spend it down. I just want to make sure I'm doing it right. How should I do it? And they'll let you know. Julia, okay, I appreciate your answer, she says. I didn't even pop it up there. Let's see here. Douglas, if I draw survivor benefits at FRA, continue to work, can I still add to my earnings accounting for when I apply for Social Security along with delayed retirement credits? Absolutely, yes. So you can collect survivor benefits, and obviously your work won't affect survivor benefits because it's based on the deceased spouse's benefits. But yeah, at FRA, that it sounds like you're trying to. I would maybe kick around your options because the year you turn your full retirement age, if you're going to wait till your full retirement age because of work, remember the year you turn your full retirement age, your limit the amount of money you can make working increases by like 3 times or more that year. So I would kick around and say, okay, if I start my survivor benefits in January, how much is it going to be? And if I start it at my actually FRA month, how much is it going to be? So, make sure you don't lose any money there. But yes, yes, you keep working, paying into yours, and every month, not every year, every month, your benefit on your own record will increase. And just call Social Security every year and say, okay, how much now? How much now? And then when it's good enough, then do it to it. Caribou kind of, thumbs up and something else. Can't see. MT Vezel. Thank you, Ed. Yeah, you're welcome. You're welcome. All right. Everybody's being nice today. I don't check these before I throw them up on the screen. And so everybody's playing nice. I like it. Since COVID, I have not gone to the doctor, been on disability since 2011. I'm afraid they're going to kick me off because I won't go to the doctor and everything's gone sky high and I just can't afford it. Yeah. If you let's see, it depends on your age or something. So if you have a CDR, a continuing disability review, that's going to your doctor on a regular basis and everything like that is important for that review. But if you don't go, that's only if you get a review. If you don't have a review, then doesn't matter. If you're getting close to your full retirement age, you're going to be switched to retirement benefits anyway. So then it really doesn't matter because you won't be on disability anymore. And she asks, is there anything I can do out on mental disability? Yeah, so another, that's proof in the pudding right there that you stay away from the doctor based on your mental disability and whatever the case may be. So you make sure you document that. You called up the doctor and set up an appointment, but then you were just not able to go that day, and make a note of that. And that way, again, it's all based if you have a CDR, continuing disability review. If you don't have one, that doesn't matter. But if you ever have one, it's nice to have some type of medical documentation that you are still disabled and you're receiving this type of medication, and whatever the case may be. But again, if you're getting close to your full retirement age, you're probably not going to get a CDR anyway. And I'm going to do a video this week on CDRs, and hopefully that will de-stress you. CDRs, yeah, Social Security does a terrible job of stressing. Well, they do a great job of stressing people out on CDRs, which they shouldn't. But it's an unfortunate part of the bureaucracy. But I'll share that with you all this week. Let's see here. Questions on TikTok. I've heard Advantage is junk. Really pushing that grocery card. Is it? Yes, they have. Yeah, Advantage. Yeah, there's a lot of people talk bad about the Advantage. I wish the whole health system in the country was a lot different, a lot better. If I ever become, as I always say, if when y'all vote me the enlightened dictator of America, that'll be my second thing I do. The first is cure for male pattern baldness, but number 2 will definitely be, fixing all that. People that can't afford the Medicare supplement, Plan G or Plan N, then their alternative is Medicare Advantage. So, I hate to talk bad about Medicare Advantage because one is, anyway. those companies don't like it when you do, and they have big lawyers. But also, there's some people that that's all their budget allows. So why give them a hard time about it. But I would definitely give them a hard time about it if they don't keep up on it. That's the one thing you have to do with Medicare Advantage is keep up on it on a yearly basis. Because again, people say, "Oh, I've got the same plan. I've had the same plan for 4 years." Number one, no, you haven't. You might have had the same card and the same doctor and the company's the same, but everything else, that's a new plan every year. And they say, "Well, I'm good because I have the same doctor and it's zero premium, and so everything is good." Well, that's not usually the things that they change. They change the stuff underneath. And it's like, okay, you have something happen, you get sick, or you have an accident and you go to the hospital, and now you're being charged $200 a day for the hospital. And you're like, wait, when I signed up for this plan 2 years ago, it was zero. Yeah, that was 2 years ago. That plan is gone. It's extinct. You have this plan now. Sure, it's got the same card and everything. So people get, yeah, they lose money every day because they don't check up on it. So as long as you continuously check up on your Medicare Advantage plan, and even the same company. Oh, I like this company. That's fine. That's fine. Awesome. But that same company, I guarantee you, it depends on your area. They have 2, 3, 4, 5, 6, 7 different plans in your area. So you just want to upgrade to the newer plan, right? Save yourself some money. I filed for SSD February of 2023, denied January 2024 without a doctor exam. How does back pay work? Well, you were denied. You're not going to get back pay. So, yeah. Sometimes they do a CE and sometimes they don't. A CE is a consultative exam. They send you to a Social Security doctor, but I guess you had enough medical evidence, so you didn't have to go see a doctor. So that's not a big deal. But yeah, if you were denied in January, hopefully you requested an appeal because you have 60, 65 days, 60 days in mail time. But if you're late, you just you do the 561, the SSA 561, the request for reconsideration, and you just put it's a good cause statement. You say, well, the reason didn't file the appeal within 60 days is because I didn't get the mail or whatever the case may be. And I've gotten thousands of those when I worked at Social Security, and I approved every single one of them. So, do Gold Star kids get any benefits? Not from Social Security or states that I know of. That sounds like it's a VA type thing, possibly. I'm disabled, and what age can I get SSI from my ex-husband? SSI is the welfare-based program, so you can't get that from anybody. You have to get that. So yeah, you probably mean SSA, but so we're married for 11 years. So disabled. So yeah, once you hit 62 years old and they are 62, then definitely call and see if there's any extra benefits there. Absolutely. The federal government took my VA scholarship and my tax return. Okay, yeah, I don't do taxes. I've been trying to cancel my taxes with the IRS for decades. Let's see here. Oh, Michelle's a follow-up on Michelle. They sent me a CDR, but then canceled it and said they would get back to me within it. Yes, that's exactly what I'm talking about right there. Yeah, stick around over the next couple of days when I do my video on CDRs, and you'll know exactly what the deal is with that. In fact, Dr. Weir, can you scroll up? I had an additional question about being bounced between Social Security and Medicaid. Sure, absolutely. Thank you. Yes. Da, da, da. I got a lot of. I'm not finding it. Oh, there it is, right there. Okay. My mouse is not working. Okay, let's see here. So how does one avoid the ping pong effect? You can't affect a bounce in between the Social Security office and the Medicaid office when asking Medicaid to pay Medicare Part B. Yeah, you can't. It's just, yeah, the unfortunate nature of the beast. In my state, because before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and stuff like that. And the system that they used was just a kind of a I guess another state had requested some company to build a computer program to take care of all that. And then when the computer company delivered the program to the state said, "This is crap. We're not going to pay you for that." And then the company went out to the other states, and my state said, "Oh, okay, yeah, we'll pay you for that. That's cheap." And yeah, it's a terrible computer system. So that's it. The two computer systems just don't talk to each other. Um, Maybe we could write you in on the ballot. Yeah, right. Yeah. Um, as always, thank you very much, Dr. Ed. Yeah, you're welcome. Welcome. Let's see, Julia, me as well. I would write. Actually, and yeah, thank you. All right, I appreciate it. When they say you have 60 days to file, is that business days or calendar days? So 60 days to file a reconsideration once you receive an official decision, that you were denied or something. And they give you 60 days plus 5 days mailing, so it's actually 65. But if it's 70 days, 80 days, 90 days, and the reason you're not doing it on time because you didn't get the mail, or you were sick, or whatever the case, you were traveling, or whatever the case may be, you just put that in add that to the 561, the request for reconsideration. Add another little piece of paper down there that says the reason I didn't do it within 60 days is because of X, Y, and Z. And like I said, yeah, I'm almost guaranteed they'll approve it. Are there scheduled times when you're on? I hate to miss all the great information that you provide us. Yeah, I do. I am on a roll. I think I've done this, 15, 20 days every single day. But my regular scheduled was it Thursdays at 4 o'clock West Coast time, and Sundays West Coast time, 3 o'clock West Coast time. But yeah, I've got so much information out there, and so many people need help. I'm just, if I've got an hour, I just pop up, and I'm doing these pretty much every day. Okay, let's see what are the kind of TikTok we have here. If you are injured at work and haven't worked in years, how does that affect Social Security? Yeah. So if you haven't worked in years, again, if you worked for 5 years, again, the currently insured thing, if you work for 5 years and then took off for 5 years, you still have 5 out of the last 10 years. So you are currently insured. So if you are currently not working because of your disability, and your disability is going to last 12 months or longer, please, 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 please watch my videos and immediately apply for benefits. Not enough space to type. Yeah. Let's see. I'm disabled. What age can I? Okay, I answer that. I've been on SSDI since 2018. Am 50 years old and get Medicare A and B. Any other benefits I qualify for? Yeah, if you have A and B, again, those are original Medicare. Then you're 50 years old. So yeah, so probably in your state, a lot of states, if you're under 65 years old, they don't let you get a Medicare supplement plan. Maybe they do, and if they do, it probably 3 times, 4 times more expensive than anybody else. So most people get a Medicare Advantage plan in that case. So get a Medicare Advantage plan to cover everything else, all the gaps. And then once you hit 65, then they can't deny you. They can't charge you anymore because you're on disability. When you're 65, you're in that golden window. So get the Medicare Advantage now, cover those gaps, check it every year to make sure you're getting what you paid for, because this company is giving me 0 premium every month and it's so awesome, and they're giving me this, that, and the other. They're not giving you anything. They're giving it back to you. All that money you paid into FICA for decades, a few percent of that went to Medicare. And that money is sitting in Washington or wherever. And then when you sign up for this Medicare Advantage plan or Part D plan or whatever, that company goes to Washington and says, hey, give us this person's money. And so that's your money. So make sure you get it. Can I pull my ex-husband's Social Security while mine grows? Married 11 years. No, you have to file for benefits on your own record unless he is deceased. But yeah, if you're filing for someone that's still alive and kicking, you have to file for benefits on your own record first. All right, this will be the last question. I've been doing this about an hour here. When filing in X benefits, how long do you wait after filing for your own before filing on record, divorced spouse? Yeah, you have to file at the same time, pretty much. Well, you don't have to, but you can file for your benefits and then spouse benefits later, whatever the case may be. But yeah, you have to file. If you're going to, you want both, then you file for both at the same time. You file for a retirement claim on your own record, and then you file for a spouse claim on that person's record. All right, that is we've beat that one into that beat that horse. So hour and 10 minutes. So all right. Thank you all. Make sure you share and subscribe and like and all that kind of good stuff. And we will